We present you ELLIPSE, Synthea Plus-Tex interspinal stabilization system. It is indicated to correct the excessive and abnormal motility between two vertebrae, without permanently altering biomechanics physiology, and avoiding stabilization surgery through arthrodesis, which irreversibly fuses the adjacent vertebrae. It is used for the treatment of chronic pain in the lumbar region and lower limbs. ELLIPSE is composed of an interspinal spacer in PEEK and a stabilizing element in titanium. The spacer in PEEK has a modulus of elasticity similar to the human cortical bone. The titanium element is the functional part, subjected to loading forces, with an optimal sealing in the closing phase. It is also the radiopaque marker of the device. The main features of ELLIPSE are the monolateral fast and easy mini-invasive access, no sacrifice of the supraspinous ligament, the radius for spinous process housing, and good fatigue resistance. 5 million cycles were carried out without breaking. ELLIPSE is available in 5 heights: 8, 10, 12, 14, and 16 mm. The instrument set for ELLIPSE implantation comprises few components and is very easy to use. It comprises an implant holder, a distractor, different trials, and 2 starters. The implant holder is composed of a locking system, pin, and a trigger to slide the stabilizing element. The first step of the surgical technique is the insertion of the starters to open the interspinous ligament at the segment to be treated. Place the measurement spreader between the 2 spinous processes and apply a non-excessive distraction. Once the desired interspinous space is created, the size of the trial to be used can be read along the shaft of the instrument. Remove the spreader and proceed with the appropriate trial, ensuring that the instrument will provide a good fit. Assemble the proper size implant on the holder by positioning the device, taking in consideration that the closure in titanium is facing upward, and groove on the component in PEEK is to the left. Hook the lateral side of ELLIPSE to the holder, making sure that its jaws fits in the grooves of the device, and the instrument end correctly connects to the hole positioned at the end of the closing in titanium. Once the implant is properly attached to the holder, insert the device between the 2 vertebrae. Insert the PEEK component and complete the placement, making a simultaneous movement of distraction and clockwise rotation. Check for a correct and stable implant position, and then proceed with the closing of the sliding component in titanium by pulling the holder trigger. Finally, check for implant stability and disengage the device from the instrument. The final configuration is obtained